Good evening. First tonight, the impacts of coronavirus on the mental health of NHS staff dealing with some of the sickest patients. Libby Macaro says she and her colleagues need time to recover from the intense times of the past 4 months. Recently, she's received unique support offered by a mental health charity in Buckinghamshire. Lindengate has 5 acres of therapeutic gardens near Aylesbury, which have reopened to key workers over the last few weeks. Louisa Curry reports.
Taking time to breathe and reflect on a difficult few months.
We face things that we would never have expected to face in our nursing lives. A lot of us have been isolated from our families and spent 3 months living in the spare room, and wearing PPE has been yet another burden. It's been hot, it's been uncomfortable. And then our poor patients that, they're the sickest group of patients that we've probably ever had to deal with. And we pride ourselves on looking after patients and families, and yet we've had this massive barrier that we haven't been able to have the relatives in. It's just not the same as holding somebody's hand and looking after them. So that's been hard. It's been hard.
Libby is a critical care nurse at Stoke Mandeville Hospital.
Now we've got time to sort of sit and reflect and breathe. I think we're able to process what we and our patients families have been through, and it has been hideous.
For the last few weeks, Lindengate have been offering frontline workers the chance to visit and connect with nature.
This is a place where they can gently start to adjust. That may be all they need to do. Start to actually realise that it's okay to not be okay, and put their toe in the water a little bit about how they might feel about getting some support and help. It's a very gentle, nurturing environment. It's allowing people to come and find some peace.
The charity relies on volunteers like Dave to help maintain the gardens.
It's about giving something back to the NHS, doing something while I wasn't working. I've got a niece who's been working on a COVID ward in South Wales, and I've listened to what she said coming home frightened, and somewhere like this is ideal to just get away from what they've been through.
They don't provide clinical care, more a listening ear, and help accessing further support if needed.
You can spend 12 hours without seeing daylight and just have some thinking space, and it's just really, really important.
150 NHS workers have already visited, but they're expecting a huge increase in demand for mental health support for all in the wake of coronavirus. Louisa Curry, BBC South Today.